Kia ora. My name's Andre Mason, and I'm a PhD student at the University of Otago in New Zealand. Today, what I'm wanting to talk to you about is the possible links between substance use and suicidality in Australian men. Suicide is a growing health concern in Australia and indeed around the world. It is the leading cause of death for Australians between 15 and 44 years old, and on average, 8 Australians die by suicide every day. 6 of these are typically male. In 2018 alone, 3,046 Australians took their own life and over 65,000 attempted suicide. So, given the growing health concern that suicide presents to Australians, and in particular Australian men, we sought to understand whether different substance use behaviours are related to suicidality. To address this research question, we used the second wave of the 10 to Men study, the Australian Longitudinal Study on Male Health, which is a national study of the health and lifestyles of Australian men at different stages of life. This data was collected across 2015 and 2016. 7,464 adult Australian men aged 18 to 60 completed the measures of interest for this research question. These included items related to depressive symptoms, alcohol consumption, and well-being, as well as single item questions related to drug use in the past 12 months, lifetime suicidal ideation, and lifetime suicide attempts. The 4 drugs you see there on the screen have been included in the analyses. Marijuana has been left as an individual variable, while cocaine, amphetamines, and ecstasy have been combined into a other illicit drugs variable. After controlling for age, we see that marijuana use and other illicit drug use in the last 12 months, as well as depressive symptoms, predict lifetime suicidal thoughts. Alcohol consumption, on the other hand, was not related. When looking at suicide attempts, we see that lifetime suicidal thoughts, alcohol consumption, marijuana use in the past 12 months, and depressive symptoms predict greater likelihood of an individual having made a suicide attempt over and above their lifetime suicidal thoughts and age. And illicit drug use in the past 12 months was unrelated, however. Further, we see that alcohol consumption directly mediated the relationship between lifetime suicidal thoughts and a later suicide attempt. The effect of this relationship was small over and above the direct relationship of suicidal thoughts on a later suicide attempt, however. In conclusion, when we look at alcohol, greater consumption was associated with a greater likelihood of a suicide attempt, but not suicidal thoughts. Alcohol consumption further mediated the relationship between lifetime suicidal thoughts and suicide attempts. Looking at marijuana, greater consumption in the past 12 months predicted a greater likelihood of both lifetime suicide attempts and thoughts. Other illicit drugs, greater consumption in the past 12 months predicted a greater likelihood of lifetime suicidal thoughts, but not suicide attempts. Cheers.